reported up to date, and made possible by SPIN Research Consortium, which I'll talk about in a little bit. The objective is to evaluate the procedural and medium-term safety, outcomes, and case rate of cerebral artery origin stenting. So just a little bit of background. The cerebral artery origin disease is a very common entity. Actually, in studies of autopsy and angiogram studies, up to 50% of patients with cardiovascular risk factor had cerebral artery origin disease. In New England Posterior Circulation Registry, 20% of patients with posterior circulation stroke or TIA had cerebral artery origin disease. And in another study by Mufari, 96 patients with greater or equal to 50% of cerebral artery stenosis were followed for an average of 4.6 years. And 98% had the disease at the origin of the cerebral artery. And the stroke rate was 24%, mortality rate of 40% as shown in the figure. So the intra-arterial embolism is the most frequent mechanism of the brain infarct. Although with an dynamic stroke also is possible when the contralateral cerebral artery is not able to provide sufficient blood flow. And as you know very well, recently endovascular procedures are more commonly utilized due to advances and reduced procedural morbidity. So this study was made possible through SPIN Research Consortium, which was formed in 2008 to pool data from emerging endovascular cases, neuroendovascular cases from multi-institutions. For this study specifically, there were 9 participant institutions, and the data were collected between the year 2000 through 2009. Each institution were asked to collect the data on all the cerebral origin stenting. The demographic, clinical, and procedural data were then sent to St. Louis, Missouri for retrospective analysis. So here's just an example of one of the cases that were done at University of Pittsburgh. And this is a 69-year-old gentleman who presented initially with ataxia of the arterial vertebrae. And as you can see, the left subclavian angiogram shows the critical stenosis at the vertebral artery origin, measured greater than 90% with the string sign. As you can see. And the follow-up images shows that the vertebral artery actually continues as a paving vessel, but in slow flow. This is post-stenting, which shows no residual stenosis. And the 6-month follow-up image shows that the vertebral artery origin remains paving with minimal to no restenosis, and the patient's symptoms has actually resolved. So here are the results, the clinical and demographic characteristics of the patient that we had in the registry. There were a total of 164 patients, with the average age of 67 and the majority were Caucasian. The most common risk factor was hypertension, with other risk factors including hyperlipidemia, smoking, coronary artery disease. Majority of the patients, 94%, presented with a TIA or stroke, which was contributed to their cerebral artery origin disease. And again, majority of them, 84%, had contralateral cerebral artery disease. And 75% had initially a modified ranking score of greater or equal to 2. The procedural data showed that majority of procedures were done under conscious sedation with transfemoral approach. Distal protection was only used in 23% of the patients. Majority of stents, 54% were drug-eluting stents, and the bare metal stent, 42%, and self-expanding stent at 2%. The procedural safety and outcome showed what we expected. The procedure was very safe, with the procedural stroke or TIA occurring only in 1 patient. That gives us the complication rate of 0.6%. And the 30-day TIA or stroke, these are the TIA or stroke in the posterior circulation, where 0.7 to 90-day was 3.8%. 30 days modified ranking score was 93% of patients had a 30-day modified ranking score less than or equal to 2, and 96% had less than or equal to 2 at 90 days. During this study, the significant restenosis was defined as any restenosis greater or equal to 50%, and the average length of angiographic follow-up was 8.5 months. There were 20% of patients that were found to have significant restenosis, and overall average follow-up restenosis was measured at 24%. So in conclusion, this is the largest multi-analysis study of arterial artery region stenting up to date, both in terms of cases and in terms of institutions that were involved. It highlights several issues, including the relatively conservative criteria to select patients for stenting. The patients were only selected for stenting after they had bilateral arterial artery disease, and which contributed to a TI or stroke. It does confirm that the procedure is very safe, with very low procedural complication. Prior case series and meta-analysis has shown the complication rate of this procedure to be at 2 to 5%. Our complication rate was 0.6%, which is lower than the other ones. This could be due to advances in technology or overall experience with this procedure. And also interestingly, almost all the cases in this study were performed by operators with dedicated training in interventional neurology. It does show and highlights the low rate of medium-term symptomatic recurrence. And again, 20% of the patients had restenosis, significant restenosis. But interestingly, no significant difference was found in the rate of restenosis in drug-eluting and bare metal stent. It does highlight the trend toward greater use of drug-eluting stent and distal protection, although as far as I know, there's not sufficient data to argue for either of these. And we hope to build on this study with other prospective studies, and again, further prospective and randomized studies are needed. And briefly, I just want to mention that the Spin Research Consortium is a great registry